What is the Healthy Anne Arundel Coalition and what do they celebrate each year? Next on Food for Thought. Hi, I'm Jodi, the host for Food for Thought, and thanks for watching. Today I'm honored to have Mindi Garrett from the Department of Health right here in Anne Arundel County. Welcome to Food for Thought, Miss Garrett.
Thank you for having me.
So can you tell the viewers a little bit about yourself personally, if you want, and then maybe a little bit about your role at the Department of Health?
Sure. So I am a lifelong Anne Arundel County resident. I grew up here. My kids grew up here. I'm actually a graduate of Old Mill High School.
So. Woo-hoo. Patriots, right?
Yes, yes, ma'am. So yeah, my heart is here in Anne Arundel County, and I'm very, very happy to be working in this position as a coordinator for Healthy Anne Arundel Coalition.
And you say, so you were in Anne Arundel County and grown here. And we say all the time, especially in the committees that we both are on, it's so nice when we're all together and we live in the community, we work in the community. And it's just, I don't know, it almost makes it electric when we're all together, right? We have such a vested interest in the communities that we serve.
Yes, absolutely. And in my personal history, so I have a background in nutrition and public health, and to work in this position where I'm leading the local health improvement coalition, and it takes place right here where I live. So I'm looking at improving the health of all the people that I grew up with.
So you're walking the walk, talking the talk, and leading our charge on our coalition. So you have a really fun fact, though. Could you share a little bit fun fact about something? So, you know, I nutrition as well. I'm a dietitian as the director of the food service division here in Anne Arundel County Public Schools. But like I played softball, I ran some track, I did some cheerleading. My kids are always like, "You were never a cheerleader." I said, "I was only been a little bit cheerleader, but you did something really cool that I just found out about." Share with the viewers.
Yes.
What's something that you did as an activity?
So I do lots of things as activities. I am very, very big into fitness, but one fun fact I can share is that for 2 years recently, I played on a women's tackle football team, the Baltimore Nighthawks. I was a wide receiver. It was an amazing experience. I met lifelong friends on that team.
So how many touchdowns?
None for me.
That's awesome. I had no idea there was such a thing, and it's local right here in Baltimore. Wow. So tell the viewers, so a health policy analyst with a nutrition background, right, and public health. But when I think of that, I'm thinking it's like very legislative or policy driven. Like, what do you do? What does a typical day for Mindi look like?
Well, I spend a lot of my day planning, working out spreadsheets, meeting with the partners for the Healthy Anne Arundel Coalition. And these include organizations within the government, such as the public schools, the county executive's office, rec and parks, other bureaus within the health department, and then outside organizations, our nonprofits and counseling services, the mental health agency, and always members of the community. So our work group meetings are open to members of the community. So we get a lot of input from all areas of the community. So meeting with these meeting with all the different organizations and collaborating on our specific activities to, on a general basis, improve the health of the community at large.
And we've had and we'll talk about it next, just what committees we're both on together. Really, what ones did you chair? What are you on? But like the Tennis Alliance, fitness clubs, not Bike America. The Anne Arundel County Bike folks would also be on there when we were looking at like PATS and biking.
All those, I can't think of the name,
Mm-hmm.
but yes, all of those active organizations
Mm-hmm.
with an interest in a focus on healthy activities and healthy living and healthy lifestyles.
And I think having nutrition as your background, I think that's really neat because you get to see in the Healthy Anne Arundel Coalition, and we have a HEAL subgroup that we'll talk about a little bit, but a lot of it is the mental wellness piece, and then there's a whole nutrition piece, right? Or a food piece,
yes.
which is right up my alley too. I
yes.
mean, I love it. I love to see all the different areas, and we have the wellness schools of distinction in Anne Arundel County, and that's when we look at the CDC model of the coordinated school health model. Mm-hmm. So we're looking at all 10 components, but it's really kind of neat to be sitting next to you on some of these committees, mm-hmm. looking at these really important areas and how we make a difference for the community. So what is Healthy Anne Arundel Coalition? I guess, could we start there? That's your lead?
Sure.
Okay.
So this is a mandate from the state that each jurisdiction in the state has a local health improvement coalition. And it's generally county by county. Some of them are a little bit more regional. But so the Healthy Anne Arundel Coalition is exactly that, just for Anne Arundel County. And we have specific goals or priorities according to the assessments that occur every 3 years, and then sometimes in between those 3 years, to look at the things that are, or the issues that are most important to address in terms of the health of the community.
And it could be things, such as the disease side of it, right? Like, is it heart disease, or is it diabetes, or is it, so you could look at disease specific. It also looks at disparities, right?
Yes.
Of who has access to health care, who participates in health care, or is there no access for certain subgroups, right?
Yes, very much so, because it is pointless to have services that the people who need them can't get to. Mm-hmm. So that's definitely another strong focus.
Yeah, and I think it's nice when we do meet. So I think I've been on I always laugh. I don't really know when the coalition started, but it seems like a long time ago. Mm-hmm. And I've been active right from the beginning with Anheuser-Busch from the Department mm-hmm. of Health, and I just think the coordination of all the agencies together, and I always feel like Anne Arundel County Public Schools and Department of Health are one, from mm-hmm. our coalitions that we're in, Anheuser-Busch and just their healthy eating, and really looking at the public health and how they're going to address the need for food mm-hmm.
With
her division. And then you throw in school nurses, and it's another whole subset.
And I think that's a really important job of the coalition. We sometimes sort of jokingly call ourselves the dating service of organizations in the county, because it serve as a position where we can bring people together. It's where we find out, this organization is doing something to improve nutrition in this aspect, and this organization is doing something else, or maybe doing the same thing, and instead of doing the same work separately, why don't we do it together? Mm-hmm. And so pairing up and working collaboratively instead of working in silos, so that it's more efficient. And then you're also promoting your services in a way that works better, because it's being promoted by everyone and not just individual organizations.
And I think we started in the coalition maybe a year ago, and you probably know maybe more specific, and we could just round it out to say a year ago, where you had the members on the coalition do a showcase, mm-hmm. presentation. You probably have a better word for it. I'm calling it a showcase. But I had the opportunity in 1 month just to talk about what we do in Anne Arundel County Public Schools. And what I loved is when you hear everybody talk on their month, you get to bring that back and share that with your, we share it with the Wellness Council and post it, so our communities get to see it as well.
Yeah. So I call it a partner presentation.
There you go. That's the word.
And this really came out of our retreat that we did for the HEAL committee, the Healthy Eating Active Living committee, where we were talking about all these organizations that meet every couple of months, and we talk about the HEAL goals and objectives and activities and what's important to the community and what the individual organizations see and how you see things differently. And it came to everyone's attention that we don't know really what every organization is doing. What is each partner doing? So I started to have one organization do a presentation for the entire group at each meeting. And it's generated a lot of interest and that, that matchmaking collaboration that we seem to excel at so that our organizations are working together. It doesn't always have to happen within the Healthy Anne Arundel Coalition. Sometimes it happens outside, but we can be the meeting point.
And it's kind of funny because I think we all leave with like an aha moment, like, I had no idea that's what they did, or I had no idea that I could share this.
Yes.
So it really does.
I do as well, even though I generally know each representative from each of those organizations. With the partner presentations, I always learn something new.
So when you came on board and you started the Healthy Anne Arundel Coalition, you've mentioned HEAL a few times. So I think somebody's watching is probably like, I don't know, are they talking about healing a cut? Is it
We're doing that acronym thing again. Yes.
So what's HEAL? Or, we talked about, again, Anne Arundel Coalition, kind of a mandate, just like a mandate for us in Anne Arundel County where we have wellness councils. It is a mandate. It comes from the federal level, and all school districts or all jurisdictions, local agencies have one. So we have our coalition. And what's a HEAL?
So the coalition currently has two work groups. One work group is a mental wellness work group, and the other we call HEAL. HEAL is an acronym for Healthy Eating and Active Living. So its specific focuses are on nutrition and healthy activities. And to that end, we have partners such as Food and Nutrition with the schools, and the Tennis Alliance you mentioned, some fitness clubs. We have also a subcommittee focusing on disability inclusion, which is also something that the Tennis Alliance is active in with their blind and visually impaired tennis and their wheelchair tennis. And many other organizations as well. I could fill the rest of your time with listing them because there are so many really active involved. Of course, we have Rec and Parks that are an important aspect of that as well.
And we have aging.
And aging and disability, yes.
Right.
Which they have so many amazing programs, and they're very active in the coalition on a number of levels.
I think so. Right, with our Anne Arundel coalition, and then in HEAL, and then even the inclusion, right, the disability inclusion. So it's kind of, and I know you say it's like our place where we all date, we all meet, right? Because we all want to share, but it's so interesting because it is, monthly or every other month. And it's really everybody getting together to highlight what they do or what's coming up and how do we share it within our communities. So do you have any other committees or subcommittees that you chair or that you sit in?
So I feel like I am part of quite a number of committees, so I almost hate to try to list them and leave somebody off. But I sit on the gun violence and intervention team on one of their community committee, the Suicide Prevention Coalition, the Health Equity and Racial Justice team. I'm very active in their work with the community health ambassadors, let's see, the subcommittee for disability inclusion through HEAL. We call this the Accessible and Healthy Anne Arundel. and the Health and Wellness Committee, which I think is North County and chaired by James Merritt from the Merritt Health Club, who's an active member of the coalition as well, and the Food Council with you.
Mm-hmm. Yep. So I think our paths cross all the time.
Yeah,
right?
all the time.
All the time. And it's funny because I think as much as I know you and as much as I get to see you all the time and do work that's going to impact our students, our staff, our communities, our elderly, like everybody, I learned so much just going through the preparation for the show today. Like you have so many hats and you touch so many different pieces. And I think it's something that the Department of Health does so well in our county. And I'm sure other counties are, I'm sure they have very similar things, but they definitely can't be at the level that we are in Anne Arundel. And
it definitely makes me proud to work for the Anne Arundel Department of Health, definitely.
Yeah, I mean, it's just amazing, just the depth and the reach and the impact that is, occurring each and every day. So let's talk about, so we have our Healthy Anne Arundel, we have all our HEAL, we have our subgroups. You and I are together all the time. We all wear many hats. There's something that the council started many, many moons ago, and they said, we're going to celebrate. And once a year, we're going to try to have a celebration. So what's that celebration all about, if somebody was watching?
It's one of my favorite things to do with my job at the health department. It is, we call it Healthy Anne Arundel Day. We really celebrate it for much longer than a day, but it was decided a few years ago we were going to celebrate it each day on April 7th because April 7th is also World Health Day. So this is a proclamation that we get from the county executive and from the mayor of Annapolis each year proclaiming Healthy Anne Arundel Day is April 7th. This year, we are starting our celebrations early and working in collaboration with the food bank to do a healthy food drive, which we are going to start March 1st. Because March, as you know, is Nutrition Month. So we have several locations throughout the county which are going to serve as hub events. So essentially the hub events are a health fair with a focus on nutrition and activities, physical activities. So you'll still get the same health fair resources, but you'll also find organizations such as athletes serving athletes, and the health fairs that are being held at health clubs such as the Merritt Club and the Y in Pasadena and the Y in Arnold. They have their own facility to do a lot of activities as health clubs, and the Severna Park Community Center is another one with a lot of activities they're going to be having all day long. And their adaptive swimming program will be a feature there as well. So at each of these locations, they will be accepting donations for of healthy foods for the Healthy Food Drive, and we'll be collecting them as we get more locations committed to Healthy Anne Arundel Day. Then that will be published on our landing page, which is not quite published yet, but soon to come. So there will be a Healthy Anne Arundel Day landing page where you can find all this information, and all of the events will be open to the public. There are also some satellite events at dance studios, other smaller gyms, local gyms, just saying, drop in, do a free class, or, a free week-long membership. There are lots of little offers that are trickling in just county-wide for organizations that are saying, I can be a part of Healthy Anne Arundel Day, I can do this thing.
And it's so funny because, from all the way back when it was like we would celebrate it, and we were always like, it's Healthy Anne Arundel month, right? And it's still really, I mean, I know we're saying it's the day, but you've just said like all of March, what a great way to really tie in the nutrition month, tie in bringing in food. And is it all going back? It's going to the Anne Arundel Food Bank,
yes.
Correct? Okay. But, what a great way to keep it in everybody's mind and to really, we're almost celebrating really all year because I know all the agencies do things all year long.
They do, yes.
But it's just nice to say that every March we're going to really look at, doing the collection of the food, and then that day is really going to be the big day for Anne Arundel County.
And it's really an opportunity for residents who maybe don't know about those services or resources or don't know that they're available to them to check it out and understand what all the wonderful programs we have in this county. There's a lot here that we have to offer, and I don't think people know as much as I wish they knew about it.
Right, and they might not know where to go, right? So on AACPS's website, so I know we have some connections to a lot of the resources on our wellness toolkit. So we have a wellness toolkit that is part of our council in the school district, of where we have resources for, things that came from school nurses, from health education and PE, from our school nurses, etc. So I know some of it is there. Is there a place at the Department of Health that a person watching can go look, or a specific website, not necessarily to the Healthy Anne Arundel Day, but just to the coalition?
So the coalition has its own website. It is healthyannearundel.org. And there are two key ways that you can find information for resources and events. And the first is to go to the events calendar, and you'll see a listing of the events in the county that they're not necessarily county led. They can be led by nonprofits or other organizations, as long as they are free and available to the public. We can include those on our calendar. There's also a form. If you wish to have your events listed, you don't see them there, and you think they ought to be there, fill out the form and we'll get them added. And then the other way is through the Find Help tool, which is also just a quick click on the healthyannearundel.org website. And Find Help is a easy way that you can search by your zip code, and you just put in a keyword and say, I'm looking for where to get nutritious food in 21032, and you will have a list of resources at your fingertips.
I think that's unbelievable. And even the cards that were put together, right, from the coalition, just easy to look at, easy to read, easy to click. There's QR codes. So very easy, right, for somebody just to pull out their cell phone and click it, click the QR, and we'll have the QR code posted as well on the show. There's so much there, and I can't even imagine, who's behind the scenes really collecting it all and pulling it together. And I think you often are a person that's receiving all of that.
So the Find Help organization has people that do a lot of the work, and that's that is part of a grant that we received from Care First to have this service as part of our Healthy Anne Arundel website, so that we get to use the resources at Find Help and have them directly connected to the Healthy Anne Arundel site. We also have our community health ambassadors that I mentioned before with the Health Equity and Racial Justice team. And these are individuals who are essentially the boots on the ground. They are people who are known in their individual communities and are at the health fair events, and at just always in their community. And the community members know that they can ask them. They have the Find Help tool resources at hand. So for the residents who don't know about Find Help yet, there are other ways to get that. The health ambassadors can say, I will find this for you, and they're doing wonders at it.
So they'll even do the research then, right?
Yes.
So what a great asset, right? For someone who maybe is struggling, they're not sure about electronic or doing something electronically.
Right, or don't have a cell phone or don't have internet.
Mm-hmm. Now, and libraries are a great spot, though, right?
Yes. The libraries have been an amazing partner. I think not just for the Healthy Anne Arundel Coalition, but they're in this county an amazing partner for everyone else in the county.
Yeah, and I think just their access for those computers and things, right? So when you're talking, and it's funny because I always say in school food service, I want to be able to put on the calendar, eat school breakfast, have school meals every day. We do breakfast every day. We do lunch every day. We do dinner in some schools. And it's so funny because I'm always like, oh, darn, like it's not a special event. It's just something that happens every day. But working with our libraries often, even for a family that is struggling and they think they need free and reduced price meals, if they don't have a phone and they don't have a computer, they can go to the library, and they can do it right there. Yeah. They can also call our office. I mean, we always say, call our office. We'll walk you through. And the same thing for somebody watching today. If they called our office, we would be able to get everybody connected to those right parties to be able to make that magic happen. So I wanted to talk real quick about, we did talk about the Find Health, and there's a community needs assessment. So you talked about goals a little bit.
Yes.
It's very specific. We don't just throw a dart. So somehow we do an assessment, and that's how we know what we're going to be able to address as a coalition.
Yes. And each year in the county, every 3 years in the county, they look at updating our community health needs assessment. That's the major look at what the health needs are of the residents of Anne Arundel County. And this is a collaboration between the two area hospitals, the Department of Health and the Mental Health Agency. So they work as a steering committee, and they are looking at collaborating with community members to find out exactly what those needs are. So this is identified through this collaborative assessment, and we at the coalition, of course, use this information to tweak what our goals and priorities are as we learn new information. Of course, it's not the same as it was 3 years ago. So this assessment is just being finished right now, and we will be reviewing our goals and priorities in the spring when that assessment is finalized, and looking at what has changed over the past 3 years. And it's also something that we look at in between. You don't just come back 3 years ago and say, oh no, everything's different. Right. We can see it because we live here and we work here and we know what's going on. So we are always looking at how things are changing and trying to adapt as quickly as possible so that we can be a benefit to the community.
And I love it that it aligns all of our goals and activities to be very specific to meet the needs of the community.
Yes.
So absolutely great information. I think we could talk on and on and on. I've learned so much more about what is really a health policy analyst, and especially in your role. I know there's I think one or two of you maybe at the Department of Health with two different roles, but it's amazing the work that you do and what you do to share with our coalition and our sub-work groups and everything you do. So thank you so much for being part of our team.
I am pleased to be here. Thank you.
Thank you. As you can see, it's so important what the Department of Health does each and every day in collaboration with AACPS. If you have any questions about the school meals program, please call me at 410-222-5900. Thanks again for watching, and I'll see you next time on Food for Thought.